different scoring systems and classifications used in obs-gynae. First one is Bishop scoring system. Bishop scoring system is used in induction of labor, and it is scored from 0 to 3, 0, 1, 2, 3, according to the five parameters, that is dilatation in centimeters, position of the cervix, effacement in percentage, station -3 to +3, and cervical consistency. First of all, we will be seeing the dilation. In 0, the cervix is closed. In 1, the cervix is 1 to 2 centimeter dilated. In second, the cervix is 3 to 4. And in third, it is 5 to 6. So, how we will remember it? 1, 2, 3, 4, 5, 6. Okay. Then is position of the cervix. Position of the cervix is posterior, mid position, and anterior. There is no score of 3 in this position of the cervix. Then is effacement. Effacement is 0 to 30, 40 to 50, 60 to 70, and 80. And then is station. Station is -3, -2, -1, and +1 and +2. Then cervical consistency. Cervical consistency is also scored from 0 to 2. So it is firm, medium, and soft. So the main work lies in how we will remember the numbers. In the dilation, it is simple. 1 is 1 to 2, 2 is 3 to 4, and 3 is 5 to 6. In the effacement, 0 is 0 to 30, 0 to 30, then 40 to 50, 60 to 70, and then 80. And in station, it is -3 to +3. That is -3, -2, -1, and +1 and +2. So five scores are there, and according to that, Bishop score is considered. Then there is one modified Bishop score. In the modified Bishop score, the effacement, which was in percentage, it is replaced by the length of the cervix. In the 0 point, it is more than 4, and in the 1 point, it is 3 to 4, and in 2 point, it is 1 to 2, and in 3, it is 0. So the length of the cervix is decreasing. And from which number we are starting? From more than 4. More than 4, then 3 to 4, then 1 to 2. Also, we can remember it in the reverse order: 1, 2, 3, 4, and more than 4, as it was in the dilation part. Then we are done with the Bishop score. Other all the parameters are same as it was in the Bishop score. In the modified Bishop, it is also same. Only the difference is of effacement and length. Then we have the Tennessee classification of HELP. Tennessee classification of HELP syndrome is: HELP syndrome stands for hemolysis, then elevated liver enzymes. EL stands for elevated liver enzymes, and LP is low platelets. And in the hemolysis, what all they can give? They can give decreased haptoglobin, cystocytes. Cystocytes means fragmented RBCs, and abnormal peripheral smear. Then is total bilirubin more than 1.2. Total bilirubin more than 1.2. Why it is so? Because when the RBCs will be breaking, there will be bilirubin, a release of hemoglobin, and hemoglobin will further be converted to bilirubin. Then is lactate dehydrogenase more than 600 units per liter. And in elevated liver enzymes, it is AST, aspartate aminotransferase, or alanine aminotransferase more than 70 units per liter. And low platelets is less than 1 lakh. Platelets less than 1 lakh. And in Tennessee classification of health, we need to remember that all the three criteria, that is hemolysis, elevated liver enzymes, and low platelets, should be present. Not it is not 1 out of 2 or 2 out of 1 out of 3 or 2 out of 3. It is 3 out of 3 required for the HELP syndrome. Then we have the difference between the acute fatty liver of pregnancy and HELP syndrome. Acute fatty liver of pregnancy is, we need to remember, means basic हमें क्या याद रखना है कि acute fatty liver है. Acute है तो ये ज़्यादा serious है. Okay, so acute fatty liver is linked with nulliparous and twins, while HELP syndrome is linked with multiparous and older. In acute fatty liver, jaundice is common, ammonia is high, encephalopathy is present, platelets are low to normal, prothrombin time and APTT both are prolonged, and fibrinogen and glucose is low. While in the HELP, parity is multiparous and older women, no jaundice. Jaundice is uncommon. Ammonia is also normal, and cephalopathy is negative. Platelets are low. Platelets are low. This is understandable from the name itself. Okay, then prothrombin time is normal, APTT is normal, fibrinogen is normal, and glucose is normal. So, all the other things that were present in the acute fatty liver of pregnancy are negative in the HELP syndrome. Okay, these diagnostic difference we need to know between the AFLP and HELP syndrome. It will be helpful in many clinical conditions, which will be we will be confusing. So from this table, we can easily answer that type of questions. Then is Quintero staging of TTTS, that is twin twin transfusion syndrome. In the Quintero staging, stage 1 is DVP more than 8 centimeter in one sac and DVP less than 2 centimeter in the other sac. Means one will be having polyhydramnios and other will be having oligohydramnios. Then is second is stage 2 is non-visualization of the fetal urinary bladder in donor over 60 minutes. Stage 2 is non-visualization of the bladder. Then stage 3 is Doppler abnormalities. It can be absent or reversed end-diastolic flow or absent in the umbilical artery, in the ductus venosus or umbilical vein pulsations. Then stage 4 is hydrops in one or both twins, and stage 5 is demise of one or both twins. So, how we will remember in which stage what it is? First one is DVP. We are only seeing the amniotic fluid volume. Then we see amniotic fluid volume abnormalities in the twins. Then we will see how ultrasound we will do for the bladder. If bladder is not visible, then we will do Doppler. Then is 4 and 5 are serious stages. First, hydrops will occur and then demise, means death of the fetus will occur. Okay, so how we will remember in the increasing severity. Then is perineal tears. Perineal tears, first degree, second degree, third degree, and fourth degree. First degree is injury to perineal skin only. How will we be remembering it? We will be remembering from like we are going from the outside to inside. So outside it will be skin, injury to perineal skin only. Then second degree is injury to perineum involving muscles but not the anal sphincter. But it is involving muscles. ओके एंड थर्ड डिग्री में क्या है मसल स्किन भी हो गया इन्वॉल्व मसल भी हो गया और उससे अंदर क्या आ रहा है हमारा स्फिंक्टर कॉम्प्लेक्स आ रहा है तो एनल स्फिंक्टर कॉम्प्लेक्स इन्वॉल्व हो गया then third degree is further divided into 3A, B, C, depending upon the involvement of the external anal sphincter and internal anal sphincter. In the 3A, it is less than 50% of the external anal sphincter tone, 3B more than 50%, and 3C is both external and internal anal sphincter is torn. And then is fourth degree. Fourth degree is injury to the perineum involving the anal sphincter complex and mucosa. सबसे अंदर क्या है म्यूकोजा तो वो भी इन्वॉल्व होगी तो फर्स्ट डिग्री इज स्किन सेकंड डिग्री इज मसल्स थर्ड डिग्री इज स्फिंक्टर्स एंड फोर्थ डिग्री इज म्यूकोजा then is leiomyoma subclassification system how we will be grading or scoring the fibroids okay so first one we will be starting from 0 is pedunculated intracavitary 1 is less than 50% intramural and 2 is more than 50% intramural. Then 3 is contacts the endometrium and 100% intramural. Then 4 is intramural. 5 is subserosal more than 50% intramural. 6 is subserosal less than 50% intramural. And 7 is subserosal pedunculated. And 8 are others. So easy way to remember it is 0 वाला क्या है पेडंकुलेटेड इंट्राकैविटरी मतलब पूरे कैविटी में है और 1 or 2 are 1 or 2 are means more towards the submucosa but these are somewhat partially involving the muscle layer so it is less than 50% or more than 50% intramural देन 3 and 4 क्या है प्रॉपर इंट्राम्यूरल ही है एक तो क्या है कॉन्टैक्ट कर रहा है सिर्फ एंडोमेट्रियम को ठीक है दूसरे वाला क्या है सिर्फ इंट्राम्यूरल एंड देन इज 5 and 6 आर बाहर वाले आगे सबसिरोजल बट उसमें भी क्या है कि कुछ पोर्शन उनका क्या है मसल में होगा, तो लेस देन मोर देन 50% आएगा पहले, मतलब ज़्यादा पोर्शन मसल के अंदर है, फिर लेस देन 50% इंट्राम्यूरल. And 7 is subserosal pedunculated. Pedunculated ones are 0 and 7. Then 1 and 2 are linked with the submucosal, 3 and 4 are linked with the intramural, and 5 and 6 are linked with the subserosal. And 8 are others, example cervical or parasitic. So, what is hybrid leiomyomas? Hybrid leiomyomas are those which are impacting both the endometrium and the serosa. Two numbers are listed separated by a hyphen by the convention. The first letter to the relationship with the endometrium, while the second refers to the relationship with the serosa. One example is below, like 2 and 5. 2 and 5 क्या है? Submucosal, 2 is submucosal, and 5 is subserosal, each with less than half the diameter in the endometrial and peritoneal cavities respectively. Means उनको denote कर देना है 2 नंबर से, ठीक है, 2 and 5. So that's about the fibroid classification. Then we have Mullerian anomalies. Mullerian anomalies, we need to remember the classes, that what class it is. Okay, first one is Mullerian agencies. First one is that nothing is means generated. There is nothing remnant or means nothing the product of the Mullerian ducts, uterine, cervical or vaginal agenesis or hypoplasia to varying degree. Hypoplasia या agenesis है. Second is unicornuate uterus. Then third is didelphus. Four is bicornuate. Five is septate. Six is arcuate. And seven is DES. Diethylstilbestrol related uterine anomalies. फर्स्ट आ गया एजेनेसिस, सेकंड इज यूनिकॉर्नुएट, फिर डाइडेल्फस. यूनिकॉर्नुएट के बाद बाइकॉर्नुएट नहीं है, यूनिकॉर्नुएट के बाद डाइडेल्फस है, फिर उसके बाद बाइकॉर्नुएट आ रहा है, फिर सेप्टेट, फिर आर्कुएट, एंड देन इज डीईएस रिलेटेड यूट्राइन एनॉमलीज. So that are all about the important classifications and scoring systems in the OBS gynae, which are important for the NEET, PG and INI CET exams. We need to remember them carefully. So that's all. Thank you.